Test. All right. Assalamualaikum and a very good afternoon. Welcome back for Breakout 3. I hope you guys all enjoy your lunch. Yes? Yes. Save your stomach for dinner. Now, without further ado, let's begin our Breakout 3 with our chair, which is Prof. Ranjith, but he hasn't joined in yet.
All right, I'll commence. Good afternoon, everyone. Thank you for joining the session 3. We are starting with a couple of presentations today. We have 6 presenters lined up for the session 3. And as you know, your time is limited to maximum of 10 minutes. So make sure that you control your presentation to limit of just 10 minutes. We have today Dr. Muhammad Ramdan and Sylvie Laitalul Mahfida or Noor Ain Zainar, Adni Haswanis Adnan, Rosai Hraini Rosli, Noor Shafi Shari, and Sun Wen Quang. Let's start with the first presenter, HE001 paper number, Dr. Muhammad Ramadan and the partner.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone. Thank you to.
Will you speak a little louder? I cannot hear.
Okay. Can you hear me, Prof. Ranjith? Prof. Ranjith, is it clear?
No, not yet. You need a little bit more sound, please.
Prof. Ranjith, is it clear?
Yeah, that's fine.
Okay. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone. Thank you to Prof. Ranjith as chairperson for today's session. Now, my name is Ramadan. I will be presenting together with Miss Sylvie Lailatul Mahfida on a research entitled Online Food Delivery Practices and Association with Body Mass Index among University Students. So I'd like to pass on to Miss Sylvie to start off with the presentation.
Okay, thank you. Online food delivery services or OFD have become a real part of the lifestyle of our communities. OFD is a new aspect to unhealthy dietary pattern and reduce physical activity levels. Nowadays, it has become increasingly common for university students too. It leads university students to purchasing unhealthy food and unhealthy eating pattern. The situations can put their health at risk with non-communicable diseases. And neglecting to address these issues can result in their manifestation the next generations of working adults. Therefore, this study aims to investigate the utilizations of OFD among university students. The primary objectives of this study are to assess the utilization and perception of online food delivery services among university students, and to examine the associations between the frequency of using online meal delivery services and the BMI of university students. The finding of this study could help the developing effective intervention and strategies to enhance the overall well-being of students and at university. For the literary review, term as platform to consumer delivery operation to ready-to-consume meals, OFD facilitate the direct delivery at a diverse array of take-away foods and beverages from kitchens to doorsteps. The outbreak of COVID-19 pandemic caused an extraordinary escalation in the 47% global growth of food delivery services during year of 2020. A prior investigation in Terengganu, Malaysia investigated the motivations behind the utilization of online food delivery services among university students from rural area. They were flexible payment as the most influential factor, followed by consideration of convenience, price savings, and time savings. Another study explored the satisfaction levels of university students in Malaysia regarding the use of OFD. The finding revealed that satisfaction was significantly associated with delivery service, time, security, privacy, and price. However, these studies did not examine the perception of OFD and the relationship between OFD use and health. Additionally, the studies did not establish a connection between customer satisfaction and health outcomes after using OFD. Okay, next, Mr. Muhammad.
Okay, thank you to Ms. Sylvie. I will continue the presentation with the methodology of this research. Let's start off with the study design and sampling. We use a cross-sectional study in which we use convenience sampling, and the population that involved in the study is 150 students from UiTM Puncak Alam. And we use a validated questionnaire which consists of two parts. The first part would be look into the demographic data as well as the body mass index of the students. And the second part is the validated online food delivery questionnaire. For the data collection, we collected face-to-face, and we include those who understand English and Malay, and we exclude those who are pregnant and breastfeeding. For data analysis, for objective number 1 and 2, we use descriptive analysis. And for objective 3, we use Pearson chi-square test to find the association between the frequency use of OFD and the BMI status. Now, let's move on to the findings of the study. If you look into the body mass index, we can see that majority of the students are categorized as normal, which contributed to 46% of them, and around 38% are categorized as overweight and obese. In terms of objective number 1, which to look into the usage of online food delivery services, and we can see that majority of the students, they use online food delivery service, which incorporated around 71%, and 62% out of them at least have been used one time of OFD per week. Now, in terms of practices of online food delivery among the students mostly ordered fast food that contribute to 56% of them. And if you look at this slide, none of them ordered fruits, and very minimal of them ordered salads or vegetables. And in terms of what are the factors that contributing to the use of OFD among the students, the first thing would be the price of the food. And the least factors would be the nutritional value, in which the participant did not pay much attention to look at the nutritional value of the food. And in terms of nutritional knowledge, they rare and occasionally pay attention to it. Now, for objective number 2, which is to look into the perceptions of the students toward using the OFD, the first one, they find there's no changes among them. However, after they order the OFD, they find there's an increment in terms of weight, which is contribute to 47%, and they perceive that all the food that they order online is high in oil and salt content. In terms of association between the use of OFD and the BMI, there is a statistically significant association between the frequency use of OFD and BMI, and in terms of association strength, it was considered as moderate. Now, this study offers valuable insights into practice, perception, and association between online food delivery and its impacts on health. Health in terms of, in this study, we consider as BMI. Now, looking into the anthropometric data, our study is concurrent or in line with previous study in which they found that around 15% of the students are categorized as obese and overweight. Now, based on our objective number 1, we can see that most of the students, they ordered fast food and very minimal of fruits and vegetables. So the high calorie foods, high fat food and high sugar food can contribute significantly to high BMI, and this is in line with previous study. Now, next, looking into the perceptions towards online food delivery, majority of the students, they perceive that the online food delivery are generally unhealthy and it may increase their risk of acquiring diseases. Now, looking at previous study from Chia et al., they found out that mostly food that available online is inadequately healthy. And investigation in Canada using the healthy index model, they found out that vendors that sell online has low value or low score of healthy eating index. In terms of association between the frequency of use online food delivery with BMI, in this study we show there's a statistical association between the BMI and OFD, and this is in line based on previous study in China in which they investigated among 1,220 university students. They revealed that there's connection between frequency use of online meal delivery and high BMI. And the high BMI could be due to the participants' fast food consumption, and it was the most ordered foods in this study. And in conclusion, this study able to demonstrate a significant link between the BMI status of university students and their use of online food delivery services, and it shows that individuals are less aware of the nutritional value of online food choices and prefer to order fast food as compared to other healthier food. However, this study has some limitation in which it focused on single facility study, so the findings may not be able to generalize into other part of the population. However, this study also contributes to the related field of the study in which it offers an insight into the factors and practices that influencing the use of online food delivery services among university students, including their perceptions. I think with that, I end my presentation. Thank you very much.
Thank you very much, Mohammed, Ramdan, and Sylvie. You talked about the research that you did in trying to establish a relationship between online food delivery or food consumption, for that matter, and BMI. What we will do is now open the floor for any questions from the audience, if anyone has any questions to raise from this particular research. Does anybody have any question?
Yes, Prof, there's one.
Dr. Ramadan, how are you? I have two questions. One question is, I'm sure among the participants, there are students who are taking both online food delivery and also offline. So I mean, it's quite difficult. It's variable to the association too. There are plenty, right? For example, they are taking online food plus also they consume non-online food. That is my first question. Second question is, with the current movement of boycotting certain product, does it really an impact to their consumption? Thank you.
All right. Thank you, Dr. Akisa, for the very good questions. So the first question, he asked about, is there any other factors that may contribute to the result of the study? Yes, it is. The overall dietary pattern may impact the BMI, but in this study we only focus on the use of online food delivery services. So to get the overall overview of the dietary pattern, we need to have more parameters to find the correlation between those variables. For the second one, yes, boycotting is one of the currently we are doing now. However, as a student, price as number one factor that contributed to the use of online food delivery. And in this study, we found out that fast food among the cheapest and easiest and convenient food that mostly the students order. Yeah, thank you, Dr. Akisa. Hope I answered your question.
Thank you. Thank you for the question. Any other questions? Well, anyone has a question? No, it doesn't look like there is any other question coming from the floor. Or is there one?
No, Prof.
No, not from the floor. Well, in this case, I want to raise another fundamental question, actually. I think the research that you presented has a fundamental flaw. The point is that the university students are ordering fast food once a week. The maximum that you found was that they were ordering food only once a week, not on a daily basis, and not all the 3 meals per day. And the BMI is not dependent on this one meal. BMI depends on all the food that consumed during the entire week, which has a lot of other food. And you were complaining that they were not ordering fruit. Of course, they wouldn't be ordering fruit from the online delivery, but they would be consuming fruit, and you don't know whether they consume fruit or not. They have access to fruits and other vegetables from other restaurants and cafes and at home and so on and so forth. So it is not possible for you to conclude that the BMI of these students increased or decreased or whatever, only based on this particular single delivery per week. There is a lot of other food that goes into the body. Over the week, 3 meals per day, 7 days, that is 21 meals per day, per week, out of which only one has been ordered online. And therefore, you cannot use this research in any sense to conclude or suggest even that this BMI is dependent on this single delivery of online food. Do you understand what I'm saying? So the research is fundamentally flawed on that basis. What would you say to that?
In terms of the overall study, so this is just a piece of a big study in which we evaluated the use of OFD as well as the BMI, but we also have another data that we are not presented here, in which we look into the overall dietary data as well as the physical activity and other factors that may contribute to the high BMI. So yes, I will agree with you, Prof. Ranjith, if we look into this one side, it may be insufficient enough for us to conclude that the BMI may not really or solely contributed due to the use of AFD.
All right, thank you very much. I think you will be looking at the research a little bit more closer to try and ask the scientific validity of what you are claiming in terms of correlation between these two, given the fact that this is only one. Okay, thank you very much. We don't have much time to spend discussing on this. Thank you very much for the presentation. It raises some basic questions about online delivery. Thank you. We'll move on to the next presenter, who is Noorine, paper number H. Noorine is going to talk about non-pharmacological intervention to improve motivation among patients with schizophrenia.
Without motivation, people would feel unmotivated and uninterested in doing things, leading to a lack of progress and innovation in society. Good afternoon, everyone. Today, I am excited to share insight from our scoping review on non-pharmacological intervention aimed at enhancing motivation amongst patients with schizophrenia. Let's delve into diverse strategies that contribute in improving the well-being of individuals facing this challenge. My name is Noorine binti Zainal Karim. Presenting with me today, Ms. Andrani Prativi. Please introduce yourself and proceed with the slide presentation. Okay, thank you, Ms. Andriani. For this review, we followed a structured process outlined by Arct and O'Malley. We searched key database like Scopus, Web of Science, and Science Direct in December 2023 using specific keywords related to motivation intervention in schizophrenia. We focused on articles published between 2013 and 2023, written in English and available in full. After removing the duplicates, we screen titles and abstracts, then examine full text to gather relevant data on motivation interventions. Our selection criteria included articles discussing intervention for motivation in schizophrenia treatment. This figure shows how we select articles using the Prisma diagram. We look for the studies that discuss motivational intervention for schizophrenia and author screen titles and abstract, then review full text for relevant information. We also check reference lists for additional studies, and the other authors independently assess some of the full text, and any disagreement were resolved through discussions among all the reviews. For the finding, the search found 80 articles on motivation intervention in schizophrenia, narrowing down to 75 after removing duplicate, and 16 studies met the criteria for inclusion after reviewing the abstract, and most studies, which are 15 out of 16, were done in Western countries. 6 were randomized control trials, and others used different methods. Among the 16 selected studies, 13 types of motivation interventions, 13 types of motivational intervention were identified, falling into 3 main categories, which are physical and cognitive intervention, psychological and behavioral intervention, and technology-based intervention. The psychological and behavioral intervention were the focus of 7 studies, which aiming to support individuals with schizophrenia in community setting. These interventions address various aspects such as improving motivation and exploring correlation with mindfulness. 5 studies examine physical and cognitive intervention for non-hospitalized schizophrenia patients, which exploring their lifestyle intervention effectiveness and the association between the cognitive deficit and motivation. And the other 4 studies look into intervention using mobile and computer application, aiming to improve motivation and overall quality of life. These interventions included interactive elements like memory tasks and personalized approaches to intervention delivery. As for the discussion, this review looks at ways to help motivate people with schizophrenia without using medication. And then we found 16 articles that talk about different approaches like psychological therapies, exercises, and using mobile or computer apps. These approaches offer new options for healthcare providers, and the interest in non-medication treatment has been growing over the past decade. While some studies have limitations, like small group of people, the positive results show promise in improving motivation for those with schizophrenia. The reviews shows that psychological and behavioral approach are discussed the most, and followed by exercise and using technology. It highlights the importance of tailoring these approaches to each person's needs. And a typical motivation intervention might involve sessions held a few times a week for 2 to 12 months, and the positive outcomes seen in this study have implications for professionals like occupational therapists. However, it is important to know that these studies mainly focus on Western countries, and they don't include people in hospital, so the results may not apply to everyone, especially in Asia. As to conclude, this review acknowledged limitations as incomplete data, biases in publication and selection, and language restriction to English study, while the quality of article was not assessed. The strengths include filling gaps in the literature and outlining common non-medications intervention. However, there are fewer Asian intervention studies and methodological limitations. The extensively researched interventions involve psychological, behavioral, physical, cognitive, and mobile computer application, and decision typically occur 2 to 3 times weekly over 2 to 12 months to improve patient motivation. And further research is needed to define optimal parameters and long-term effects. As for recommendation, address language and publication biases by including studies in language other than the English will be helpful. And we need to conduct more research in Asian population to fill gaps in knowledge and better understand cultural factors influencing motivation intervention. And we need to explore diverse methodological approaches to improve the quality and reliability of research findings. And we need to investigate the long-term effect and optimal parameters of non-medication intervention to enhance their effectiveness and sustainability. And then collaborate with healthcare providers and patients to tailor intervention to individuals' needs and preference. That's all from me. Thank you.
Thank you very much for that interesting presentation about schizophrenia and motivational interventions. I was wondering whether there is a non-motivational intervention also. Is there anything like that? All interventions are motivational, isn't it?
Sorry, actually I can hear you, but now it's double voice. It's not too clear.
Okay, you're talking about non-pharmacological intervention. All right, let us open the floor for discussion and see if anyone has any questions.
Hello, Assalamualaikum and very good evening to all of you. I am Tutu Asri. I just want only one question. As we know that patients with schizophrenia is very important to have some intervention for them because of we know that schizophrenia patients needs some maybe rehabilitation or any treatment for them. So why did you choose non-pharmacological instead of others intervention for them in terms of motivation? Thank you.
Okay, thank you for the question. So let me get it my mind first. Okay, so the question is why I choose the non-pharmacological interventions for the schizophrenia patients. Okay, thank you. So non-pharmacological intervention, something offered a comprehensive approach treatment that can address multiple dimensions for these disorders. So this non-pharmacological intervention actually focus on improving the overall well-being of individuals with schizophrenia. And these non-pharmacological interventions often target psychosocial factors that contribute to the maintenance of the symptoms and functional impairment. And this non-pharmacological intervention also is a complementary intervention for the pharmacological intervention. So it is also suitable for the long-term management as for relapse prevention, as it provides some behavior, physical and also cognitive inputs. And additionally, we can say this non-pharmacological intervention is cost-effective. So I believe, in summary, non-pharmacological intervention study for schizophrenia is motivated by the desire to provide the holistic, effective and sustainable treatment that can improve the system, functional outcomes, and overall well-being for individuals who are living with this disorder. Okay, thank you.
Thank you very much for that wonderful presentation on non-pharmacological intervention to improve schizophrenia with motivation. Thank you very much. We'll move on to the next presenter.
Okay, thank you.
Right. Our next presenter is Adni Aswanis, paper number AcE-006. We are talking about dementia this time, from schizophrenia to dementia, all elderly diseases. nurses' level of person-centeredness. It's an interesting idea. Dementia.
Thank you, Mr. Chairperson. Good afternoon to Professor Dr. Ranjith Dayaratne, my dear colleague Lady Susan, Madam Fatimah Shah, Associate Prof. Dr. Zamzadiza, and to all dear friends. Now I will call upon Lady Susan to introduce herself and start the presentation.
Good afternoon to Professor Dr. Ranjith Dayaratne, my dear colleague Andy Hazrania, Madam Matim Sham, Assistant Professor Dr. Zamzaliza, and to all dear friends. I'm Li Shuzhen from Department of Nursing Heze Jiazheng Vocational College, Heze, Shandong, China. Together with my colleague Andy Hazrania from UITM, Malaysia, would like to present a study titled Nurses' Level of Person-Centeredness, Knowledge, and Attitudes Towards Persons with Dementia. As for introduction, according to WHO, dementia is characterized as decreased in cognitive function, which involved memory, attention, language, and judgment, which will interfere with their daily activities. Caring for patients with dementia is very challenging as they sometimes become aggressive. They are highly potential for danger, being abused or neglected as they have lost their independent abilities to perform daily living activities and contributes greatly to global healthcare cost burden. In Malaysia, the estimated prevalence of dementia was 123,000 people, expected to increase from 261,000 in 2030 to 590,000 by 2050. Nurses play a crucial role on the advanced nursing care, PWD, both clinical and home-based setting in order to improve the quality of patient care and minimize caregiver stress. Despite the challenges to manage PWD's challenging behavior, we know that there are a variety of comorbidities among them, and the nurses experience difficulties in dealing with and caring for the family require further knowledge, attitudes, and skills. However, studies reported that nurses' lack of confidence, competence, and dementia-specific knowledge, which will lead to potential for misdiagnosis, improper care management, bad psychological emergence that will affect coping and the ability of nurses to continue treatment for PWD. Studies also reported that person-centered care was a gold standard mode of care PWD, but the nurses still found difficulty in choosing person-centered care practices. Study also reported that as for our literature review, Prov's study reported that nurses had sufficient knowledge of dementia. Studies also reported that the knowledge, perceived level of person-centered dementia care, and job satisfaction help to increase the nurses' attitudes towards PWD. However, little is known on how nurses specifically care for PWD. The direct link between dementia knowledge and person-centered care practices has not been clearly studied. Since this study aimed to assess the nurses' level of person-centeredness, knowledge, and attitudes towards persons with dementia. Now I pass to Andy to continue the presentation.
Okay, thank you, Susan. Now let's look at the methodology of the study. This is a cross-sectional study conducted among 223 respondents out of 543 nurses in 19 medical units in a public hospital. Sample size was determined using rows of sample size calculation, and the sampling technique was convenient sampling. We managed to obtain approval from Institutional Ethics and Medical Research Ethics Committee after the study had been registered under Ministry of Health National Medical Research Registry. In order to achieve the objective of the study, we used a self-administered questionnaire which consists of 4 sections: the demographic characteristic of the respondents, the dementia knowledge assessment tool to measure the level of knowledge of the nurses, dementia attitude scale to measure the level of attitude towards a person with dementia, and the person-centered care of older people with cognitive impairment in acute care, or we call POPAC, to measure the level of person-centeredness among nurses towards a person with dementia. And the data was collected from August to September 2023 and analyzed using SPSS version 28. And this is the result and discussion of the study. The majority of our respondents are female nurses with percentage of 84.2%, equal to 189 respondents out of 223. Most of them were clinical nurses with a nursing diploma as their essential nursing qualification. The mean age of our respondents was 31.74 years old, which is nearly half of them aged between 21 to 30 years old. Although more than half of them had experiences in a geriatric or psychiatric and had care for a person with dementia at work, only 19.3% had attended previous training on dementia. This study reported that only 17% had positive perceived experience of working with dementia, which is only 3 respondents had a very positive experience, and 35 of them said that they had a positive experience of working with person with dementia. Here is the result for our objective. There are shown that 55% of our respondents are able to answer the questions accurately, with mean score was 11.65. This showed that our nurses had a good knowledge of dementia. Most respondents know of the occurrence of the dementia due to the changes in the brain, and it is progressively. Our study aligned with the previous study by Bali et al. 2021 and also Siri et al. 2020. Bali et al. Had done their study in a geriatric outpatient clinic of a university hospital in Turkey, and Siri et al. Also done their study to the full-time working staff in acute medical unit in Malta Hospital. However, the result is contradicted with study by Chan et al. 2022, who conducted the study in multiple public and private medical institutions across Malaysia. Rahmi et al. 2021 done their study towards 34 nurses from public healthcare in Bandung, Indonesia, and Sunario et al. 2020 done their study among 332 nursing students at Universitas Gajah Mada, Yogyakarta. So we can see that the background of the respondents and the setting where the study was conducted affected the similarity and contradiction of the result. For the objective 2 and 3, the previous slide. Not finished yet. Previous slide, not finished yet. Susan, can you reverse the previous slide? Alright, thank you. Okay. For the objective 2 and 3, this study revealed the nurses had positive attitudes toward person with dementia with total mean score 85.96 or 61.4%. From the data collected, we can see that the respondents disagreed that they were afraid of person with dementia and showing a positive attitude to a person with dementia. This was aligned with study by Seri et al. 2020, at Sunario et al. 2020, and also Kuning Platina et al. 2022. For the perceived level of person-centeredness, the total mean score of POPAC was at 63.14, equal to 70.2%, indicating a predominant self-perception of practicing person-centered care among nurses in the study. They show a good and active engagement with family members, evaluate cognitive condition of the older patients, open admission, and using evidence-based instruments such as MMSE, SPMSQ, and also CAMScore. This outcome in line with the study by Seri et al. 2020 and Hayward et al. 2022, where nurses are actively embracing person-centered care practice. Okay, next one. Choose the next one. Thank you. And proven to the result of the study for objective 4, in which a positive relationship was found between attitudes to a person with dementia, dementia knowledge, and the perceived level of person-centeredness, indicated that the more knowledgeable nurses regarding person with dementia in their practice and care to meet needs associated with old age and cognitive impairment will increase. While the positive attitude influenced the person-centered care towards person with dementia. This was aligned with the previous study, thus highlighting the influential role of attitude in shaping the dementia knowledge and the implementation of person-centered care practices. As a record, the study revealed that there was a sufficient knowledge of a dementia, positive attitude, and a high standard of person-centered dementia care among the nurses in the public hospital. The relationship between attitudes to a person with the knowledge and perceived person-centeredness exists. Therefore, we believe by fostering training initiative for nurses able to enhance the nurses' knowledge, focus on attitudinal shift, and encouraging hospital administrators support the promote developing technical or intellectual and interpersonal or moral skill in quality dementia care and person-centeredness practice. Finally, this is our references. Thank you for listening, and we're open to questions.
Thank you very much for that good presentation, very good presentation on dementia-centered attitudes and scoping review. Yeah, let me open the floor for discussion if there is any question from the audience. Anyone in the audience has any question?
No question.
Looks like there isn't any question coming from the audience. I just want to raise a small question. I mean, dementia is such a common disease of the old age, prevalent everywhere in the world. And I would assume that nurses' education generally introduces the issues of dementia and how to take care of them. So knowledge about dementia must be present among all the nurses without any question coming from education itself. Although attitudes can change, certainly. So why is it that there is a lack of knowledge among the nurses, apart from attitudinal issues?
Sorry, why lack in what? Knowledge. Okay, in our study, I found out that our nurses are good knowledge, which is our result was more than half of them can answer the question correctly. And Susan, can you go to the slide objective 4? All right, thank you. Next. No, next slide. Objective 4. Next. No. Next slide. Slide number...
Findings. We need to go to the... Not the literature review.
No, next slide, Susan.
Next one.
Oh, sorry.
Level of knowledge.
Okay, we can see here that
It says correctly.
55% of our respondents can answer the question correctly, and
this is the question I'm raising. Only 55% can answer, which means quite a percentage is not able to answer. How come? Nurses' education must provide good knowledge about dementia to the nurses, and 50% of them don't seem to be able to answer. You see the question I'm asking.
Yeah, maybe our institutional doesn't organize any training for the dementia on the dementia towards the nurses. So they are lack of knowledge, but their attitude is good because they care for the person with dementia.
Okay. All right. I understand. But thank you very much for that explanation.
All right, thank you, Prof.
We conclude the session with and we'll move on to the next presenter, who is the Rosia Haywani. Paper number HE008.
Assalamualaikum and a very good evening to our chairman, Dr. Ranjith, to all the doctors and all the presenters. My name is Rosia Haywani binti Rosli. I'm from UiTM Puncak Alam. Today I will present my paper and the title is about effect of traditional Malay massage on muscle tone, muscle function and physical performance in patients with stroke. Okay, stroke is a stroke called as the brain attack. It occurs when something blocks blood supply to the brain or when the blood vessel in the brain bursts. Stroke is the Malaysian highest leading cause of death. Patient stroke present with spasticity, weakness, and lack of coordination. Management of stroke include stroke rehab such as physiotherapy. Nowadays, stroke patients use alternative treatment like massage to treat stroke. But in Malaysia, the evidence to support TMM is limited. The aim of the study is to compare the change in muscle tone, muscle function, and physical performance in stroke patients receiving TMM versus usual care during subacute phase. For the literature review, stroke is the leading cause of acquired physical ability in adults and the second leading cause of mortality in middle to high income countries. WHO stated the data about stroke increased from the year 1990 to 2019. Stroke patients comprise of increased muscle tone, decreased muscle function, and physical performance. Okay, there are three outcome measures to assess the symptom of the stroke. The first one is modified Ashwood scale to assess the muscle tone. The second one is the motor assessment scale to assess the level of impairment of the muscle function. And the last one is the Burr balance scale to assess the patient ability or inability in balance. Methodology for the study. This is historical control quadricide experimental study that include 34 patients of stroke. For control group, we have 17 patients that were collected data from the rehab unit at the Hospital Sultan Abdullah UiTM Puncak Alam. Next, we go to the intervention group. We recruit from the physiotherapy clinic UiTM Puncak Alam, KPJ Rawa, and the last one is the home setting. Both of the group were provided for 6 sessions of massage 3 times per week, 2 weeks in 45 minutes. For group TMM, we asked to stop other treatment and stop any anti-spasticity medication. TMM practitioner perform TMM massage based on the validated TMM protocol at the lower limb that affected of stroke. For the stroke rehab, they receive from the physiotherapy such as the passive movement, PNF, gait and balance, and gait training. This is the outcome measure that I use in the study. The first one is the motor assessment scale. The motor assessment scale is the total score 54. The second one is the scale modified Ashworth scale 0 until 4. And the last one is the bird balance scale. The total score is 56. Okay, the finding of the result in the study. The graph show of the motor assessment scale and the bird balance scale. Okay, we go to the first one. Motor assessment scale that shows significant improvement for both group, which is P less than 0.05. The mean for both also increased from the pre-intervention to the post-intervention. Last one is the changes between both of group was 12.6, 6.9 to 18.2. We move to the next graph. It shows to the bird balance scale. It also significant improvement for both of group, which is P less than 0.05. Means also increase for pre-intervention to post-intervention. The changes between both of group was 5.2, 0.3 to 10.0. Discussion. Both of the treatment improved in muscle function and physical performance, but no change in the muscle tone. Early management of post-stroke spasticity may not reduce this complication, but may improve function and increase independence with spasticity. One of the study used traditional Thai massage for 6 weeks and found that modified Ashworth scale score decreased by at least 1 grade after they complete the 6 weeks treatment. But TMM in the present study was short, which is 2 weeks only. The change in the motor assessment scale in the TMM group were higher due to massage can increase muscle mass temperature and blood flow and also help minimize muscle stiffness. The changes in the BBS in the TMM group were also higher due to massage help decrease level of stress and anxiety and also give positive impact on physical health. Last but not least, in the conclusion, although TMM improved the motor function and physical performance better than standard physiotherapy, we recommended stroke patients to receive both intervention because TMM more changes in the physiology well-being and the standard care more to physical well-being. Both of these restore the body to optimum health and function. This treatment can combine to provide patients with the full services approach to rehab and muscle regeneration. For the further study, I recommended the larger sample size, prospective in design, and randomized is warranted to validate the finding of the present study. That's all from me. Thank you.
Thank you very much. That was a nice presentation about the value of the traditional Malay massage on dealing with patients with strokes. Let me open the discussion and see if anyone has some questions to raise. Anyone has a question? Yeah, you should. There is a question coming from the audience.
Yeah, hello. Right, Assalamualaikum. Okay, I would like to ask one question only. And and the reason I want to ask is because right now I'm doing a massage business. Yes, it's a massage, open for men only. Massage and cupping, bekam. Yes. So I want to ask, okay, since because I'm beginning, I got a few clients, alhamdulillah. But I just want to ask, if let's say one day, for example, I cross upon a stroke patient who needs my help, I just want to ask what kind of nerve or muscles I should avoid for making the illness worse.
What the nerve?
Yes, what kind of nerve or muscles that I should avoid from making his situation worse, which is the stroke.
Oh, it's not for me. For TMM, there is no illness for the nerve because for TMM we find the nerve, then we give the pressure at the point. Beside the Asian massage like twinner, Ayurvedic, Thai massage. In TMM, we choose the nerve and pressure at the point. So no illness for the nerve, no avoid.
So as long as I hit the right pressure points, then it's alright.
Yes.
Okay. Yes, okay. That's all. Thank you.
Thank you very much for that question and for the clarification. Seems like the traditional Malay massage is special and unique and is different from other massage systems. So this is a very important point. And it is apparently effective. Thank you for the research and thank you for the presentation, which was very interesting. We will move on to the next presenter now.
Thank you, Dr.
The next presenter is Nur Shafiqa, who is presenting the paper number LM002. Current view on issues and challenges in movable property auction process in Malaysia. Immovable properties. All right, over to you, Nur Shafiqa.
Okay, thanks. Thank you, Prof. Ranjith and organizing committee. Hi and good evening to the members of the floor. My name is Nur Shafiqa.
Can you speak a little louder, please? Cannot hear. Yeah.
Dr. Ranjith, can you hear me?
Yeah.
Yes, okay, thank you.
Yep.
So my name is Nur Shafiqa binti Syari, and to appreciate my team authors, Dr. Muhammad Azwan bin Sulaiman and Mr. Muhammad Nazim Alias, and also Madam Nadia Ayu Rahman Lestari from Tarumanagara University, Indonesia. I would like to share our research today, entitled Current Review on Issues and Challenges for the Immovable Property Auction Process in Malaysia. So for the background, there are two main categories for the auction, which is the first one is the foreclosure auction, which is sometimes called public auction, and another one is non-foreclosure auction, which is often known as private auction. Private auction are initiated willingly by property owners who desire to sell their home. Meanwhile, the public auction, the financial institution usually use it to dispose the distressed property to get back their loans. The implementation of e-lelong system, which is the online auction in specific High Court in 2016, marked a significant milestone in the evolution of the property auction process in Malaysia. So despite this notable advancement brought by the e-lelong system, there remains a considerable depth of comprehensive research addressing the associated issues and challenges in the immovable property auction process. So the aim for this research paper will be addressing the gap by conducting a thorough review of the current practice of immovable property auction in Malaysia. Okay, for the literature review, I would like to address regarding the overview of immovable property auction process in Malaysia. So before the bank initiated the auction process in Malaysia, the bank should strictly follow the procedure. Okay, the first procedure, the bank should send a warning letter to the borrower and then followed by final warning notice. Lawyer sends letter asking for payment within 14 days and a letter of facility withdrawal requiring repayment within 14 days. And after that, the non-performing loan, which is NPL determination by the bank, and the notice served if the borrower failed to pay the stipulated, to pay the interest and also the principal within the stipulated time. And next, there will be court proceeding initiated, which is the borrower will be called to the court in 6th and 7th month. After that, during the proceeding of the court, the lawyers will apply to court for the direction for public auction. And there will be auctioneers appointed. Real estate appraiser determines the auction reserve price. And then only the auction process will be initiated. So, for the public auction, the property public auction practice in Malaysia usually conducted by 3 bodies, which is financial institutions such as banks, land office, and also high court. Okay, so for public auction, there will be 2 types of public auction. The first one will be judicial public auction and another one is non-judicial. So what is judicial public auction? Judicial public auction is the auction for the property that have document of title. So the document, when the document of title is issued, there will be auction off by the through the public auction, and there are 2 types of document of title registered under registrar office and another one will be registered under the land office. So for the registrar document of title issued by the registrar office will be auctioned off by the High Court and implemented in e-Lelo, which is online auction. And another one, which is the document of title registered under the land office. So the institutional that conduct the public auction is the land office, and it will be in conventional public auction, which is auction off by the licensed auctioneer. For the non-judicial public auction, there will be the property which do not have any document of title, or they only have loan agreement come assignment, which is LACA assignment. That one will be auctioned off by the financial institution, and it will be auctioned off and conducted through conventional, online, or hybrid public auction, which also will be conducted by the licensed auction. For the methodology of this research paper, we are using the newspaper as main resources. There are a few researchers have been using the newspaper as their main resources. So Sanzika stated that academics could gain advantages by accessing meticulously ordered and well-preserved newspaper collection. Lead 2021 and also Jailbreak and Snickers stated that in Finland, scholars engage in examination of secondary material such as newspaper as primary research resources, and the enhanced availability of newspaper resources is regarded is more significant than the disadvantages. Thus, the purpose of this digitization is not only to preserve but also to enhance the accessibility. Allen and Shikowitz 2010 revealed that American scholars utilize digitized historical newspaper to verify factual information. For this paper, it draws its inference from articles in four major newspapers, which is the New Straits Times, DH Malaysia, Bernama, and the Star, which contained the prints from 2016 when the e-lelong was implemented. It is important to note that while this newspaper provides valuable insight into the immovable property auction process, almost all of the auction document is private and confidential for the public. So, as the newspaper is our main resources, we are doing content analysis through the news coverage. Archival and historical materials such as new coverage can be relied solely and also have meanings and interpretation of the content. Written text is most commonly utilized data source for content analysis, and text-based content analysis is widely employed in the field of automated AcE scoring in education. We are using AcE-Bs for our content analysis. And then we are also using the desktop research such as for secondary data comprises information that can be gathered without conducting fieldwork. The primary purpose of the desk study and content analysis was to discover and analyze newspaper, past studies, research reports and documents that have been published to establish an existing knowledge of the issues and challenges for the immovable property auction process in Malaysia. For the finding and discussion, there are a few issues that have been addressed in the newspaper findings, which is the first one is hard deadlines for the payments, which KT suggested that bank provide successful bidder with short-term financing options and also advise the bidder to always have 100% fund before getting into the public auction. The second one, there are existence in syndicates operating in groups or individuals operating by threatening genuine bidders from bidding when prices are in the syndicate favor. So for the suggestion by Wong, implementation of online public auction system is to protect bidders from the interference of syndicate. From Aladesh, through the new system entails the bidders will not be revealed and the bidder will no longer be required to be present to the court to make the bids. Nur Azlin stated that shorten the waiting time before commencing auction will avoid the syndicate issues and increase the level of discretion of court officers handling the foreclosure auction to protect the bidders' registration details, provide waiting room for the registered or genuine bidders. With the security surveillance deters the syndicates, and then High Court need to authenticate the deposit required for registering bidding interest. Next, the major reason why auction property are selling far below their market value is because of not possible of internal inspection. So the auction foreclosure laws do not provide prospective buyers the opportunity to inspect the internal condition of a property. So no guarantee of a vacant possession and clean titles. Thus, Wong 2022 stated that consideration to inspect foreclosed properties prior to the auction date should be made possible, and government needs to revise the outdated auction laws to prevent foreclosed properties from being sold at a fair price, and also can consider from auction of Australia's model of making sellers responsible for providing good and clean property title before the public auction. Next is the public negative mindsets toward the auction properties. So Wang suggested that educating the public on the auction as a feasible selling mechanism for both foreclosed and also non-foreclosed property. Aisha stated that there are issues property on auction have been associated with unfair terms like inauspicious, cheap bargains, or foreclosure. And after the winning bids, there will be settling the full payment in 90 to 120 days. So Aisha stated that there need to be research to be better prepared before buying an auction property. Then bidder need to prepare for it by looking into their eligibility for a loan, whether their CRIS score is looking good among others to ease process of getting the auction property desired. Next issues, there will be some manipulation might occur between bidders and auctioneers. So Aisha stated that online auction process is more transparent. By digitalizing the process, the auction becomes fairer to all participants. And during hybrid auction, auctioneers can set a specific time for 3 calls for auction. Both on-site and online bidders will have equal chance to make a bid at the same time. For the last issues, in live foreclosure, of course, need to have court officers, plaintiff, bidders attend as a witness, hence making it open and transparent process. This may be defined if the auction made only electronically. So Deputy Chief Registrar reassures bidders do not have to worry because they have at least 4 engagement with the Malaysian Bar, financial institution, auctioneers, and Malaysian Anti-Corruption Commission by the Malaysian Institute of Integrity and Cyber Security experts to make sure this system is still intact. For issues regarding the internet glitch and also if the e-lelong system will be down, is there any backup system? So the system, if there is any problem with from the bidder sides, there will be the bidder's responsibility and beyond control of the e-lelong operation center. But if the problem encountered from the operation center, such as power failure or internet, the auction will be rescheduled to another date and time. During 2021, AMER Azlin stated that there will be issues regarding the professionals, such as licensed auctioneer livelihood will be affected. So, Azlin suggests that create e-live bidding platform that combine the electronic and also traditional auction, which auctioneer will administer the whole process as well as accept bidders online. For the conclusions, there are 6 keywords that have been created from the findings and also discussion. The first one is the strict payment deadline, presence of syndicate, internal inspection, societal stigma, possible manipulation, and last one is the existing loopholes in the court system, which is the online system from the High Court. For the recommendation, we recommended that this paper suggests the further research on issues and challenges faced by specifically bidders and also auctioneers in Malaysia property auction process using qualitative research technique. The aim is to gather the direct viewpoints and identify the most significant issues and challenges, thereby locating resources and developing targeted solutions to improve transparency, efficiency, and fairness in property auction Malaysia. Thank you. I think that's all from us. Thank you.
Thank you very much, Nusha, for that very interesting presentation on auctions in Malaysia. You took up quite a long time. I allowed you because there is time in the session. Nevertheless, let me open the floor for discussion if anyone has any questions to raise.
My name is Nurjana. Okay, why you use newspaper as your main sources of data? Even though we have, for example, Scopus, that is used as the sources of a database. Okay, thank you.
Okay, thank you for the question. Okay, I use newspaper as the main sources because there is quite limited resources for the auction, public auction. As such, in High Court, the documents regarding the auction is very limited and also private and confidential. And also, for the bylaws, we can use it as our resources, but it is not directly address this issue and challenges. So the newspaper is, I think, a good resources to gain insight for the issues and also challenges for public auction in Malaysia. Thank you.
Thank you very much for that question and the clarification. I have a very small question before we close. You mentioned quite a number of issues that related to the auctions, one of which is about the need to educate the public. Is there anything that is happening in general for educating public on auctions?
Okay, regarding the educating the public for the public auction, this is because when we say the property is going into the public auction, there will be very negative stigma. Maybe the house is in good condition, and other than that, there can be issues from the owner side, usually not paying the installments. Thus, the public need to be educated because of it's not only public auction that have auction process. We can use also non-foreclosure auction for us to dispose our property.
I see. So there is stigma attached to it, societal stigma, as you mentioned. This is a serious issue.
Yes, this is a serious issue. Yes.
All right. It would have been interesting to discuss further about this issue. However, we don't have much time. So thank you very much for that very interesting presentation about an unusual thing that you are looking at, really speaking. Very good.
Thank you so much.
Let's move on to the next and final presenter, who is Sun Wen Queng, who is presenting the paper number LRSC 001.
The topic of my presentation today is a review of the treatment for low back pain among adolescent athletes. The authors are Dr. Dayaratne and Dr. Adelaide and Sun Wen Qiang and Wang Yehong. Today's presentation will be presented by me and Wang Yehong from China. Are you here, Ms. Wang? Can you introduce yourself?
OK，能听到我说话吗，孙老师
？Okay, please speak English.
Hello everyone. I'm a colleague of Mr. Sun Wen Qiang. It's my privilege to participate in the exhibition. Thank you.
Okay, look at the picture. As the picture shows, excessive and frequent flexion, extension, and rotation of lumbar spine during exercise can cause low back pain, especially for adolescent athletes. During exercise can cause low back pain. About the prevalence and risk factors of low back pain in young athletes, the author Ms. Wang Yehong from China were introduced on the online. Ms. Wang.
Okay. The polled incidence estimate of LBP in adolescent athletes was 11% for 2 years, 36% for 12 months, and 14% for 6 months incidence estimates. The pooled prevalence estimate of LBP in adolescent athletes was 42% for last 12 months, 46% for last 3 months, and 16% for prevalent. Several factors such as age, gender, obesity, and inactivity have been reported to be associated with LBP in the general population. But for adolescent athletes, exercise-related risk factors cannot be ignored. Though sport-specific risk factors have only recently been established, many sporting activities have been suggested to potentially have a role in teenager back pain, including excessive exercise, frequent flexion, hyperextension, and rotation activities are thought to be connected to LBP. Thank you.
Okay, thank you, Ms. Wang. Now let me continue to introduce.
Thank you.
It is not advisable to treat teenagers with LBP based solely on adult research, because it has been discovered that LBP in adolescents differ significantly from LBP in adults, like the difference physical characters and cognitive difference. Therefore, cognitive treatment is still the primary line of treatment for teenagers with LBP. So management involves activity modification, breath and exercise, cognitive behavioral therapy, spinal manipulative therapy, and interdisciplinary rehabilitation. That's the light in the picture. And the objectives of this review is about the treatment such as breathing, post-cognitive training, cognitive behavior therapy, exercise, spinal manipulation, which is better for adolescents athletes with LBP. And about the method, follow the PICO, and the P words is about the adolescents, teenagers, or general and athletes, or sportsmen and cure, and that's the three we here. And the PRISMA flow diagram is showing in this picture. And consider the implicated and the teenager and the English language, young information, and their BP with record pen. We can conclude just 4 studies. And the result about the first study is about that 12 to 18 years old and 40 patients with low back pain was divided into groups. In group 1, there are 23. It's the environmental physical therapy and exercise, and 22 in group 2. self-treating according to standard bank exercise. Patients was treated 2 times per week for 12 weeks for group 1. And patients were treated 3 times per week for 12 weeks for group 2. Assessment outcomes at baseline and 12 weeks. And the outcome measures about this. And the results on comparison between the two groups, the physical function measured by Lorraine Measures disability, questionnaire, and the duration of pen measured by the perimeter improved statistically significantly in group 1. And about the second result is that 40 to 90 years old. And 36 adolescent male girls were with AcE-Bs. And 19 in the interventions group, cognitive functional of those 70 in the control group. The intervention groups, the initial session was approximately 1 hour in duration, and following up appointments was 30 minutes. Hours were staying awake after the email session and the reporting after that. Control groups there remained for free to seek treatment from healthcare providers external to the project. Access at the baseline and the 8 works and the 2 works. The out measures about this. And the results compared with the control group, the intervention group report significantly less than during neural growing and reduce this disability following the intervention and as the tutor follows up. They are also demonstrate great lower lumbar muscle endurance. And in the third studies, 13 to 17 years old, and 34 adolescents were with mechanical AcE-Bs. The method is 34 patients with acute AcE-Bs was included in the study, and 70 in the intervention group, many same group, and the 70 in the control group, same manipulating group. The total number of treatment settings provides was 80 visits for both groups. AcE outcome at baseline 4 weeks and 6 months. Outcome measures about this. And the result is that there are no difference between groups for PEN, PSFS, or GROC scores. No increased risk or otherwise reaction from lumbar motivation was noted. And the 4 studies, we can see that 13 to 18 years old and 37 adolescents excellent. 37 adolescents was included in the study in a 2 years prospective research design. In the first year, the excellence provided their usual training program, while in the second year, population-based trunk exercise intervention was implemented. So the result is that the 3-month prevalence of low back pain was reduced by 49% in the intervention compared to the control year. Further, low back pain intensity decreased and muscle strength of the trunk extensor and trunk flexor increased in the intervention year. And in the discuss like the four studies is that the first is the better result in functional ability with physiotherapy treatment may be related to the fact that children are more functional trained. For low back pain, while home remedies can be helpful, children still need specialized physical therapy. About the second this study is the first ACT to the drivers, And robbers who received the cognitive functional approach experience lasted several pen and reduced the decrease of impairment. The sensitivity to pen delivering was significantly reduced. And the third, we can find the number manipulation did not have any admission benefits. And the teenagers continued to experience back pain, and most patients' symptoms did not go away after 6 months, even with recommended rehabilitation. And the 4 studies we can find population-based intervention are effective and attractive within the prevention and treatment of AcE-Bs. So all of this, the conclusion is about that exercise, physiotherapy, treatment, cognitive functional approach, and lumbar manipulation will avoid the treatments. There is a lack of research on combination therapy for LBP in teenager adolescents. Following all treatments, a decrease in pain and impairment was observed, but it is not clear which treatment is more effective. Therefore, more studies with larger sample size are needed to provide a basis for conservative treatment of LBP in adolescent athletes. And acknowledge is we would like to thank the Faculty of Health Science UITM and ISTD and IPSRS UITM for the financial support. This is the reference. This is the reference. Thank you, everyone.
Thank you very much, Sunway and Wang Johan, for the presentation on low back pain and the treatment using physiotherapy and exercise and so on and so forth. It's an interesting issue and a very, very relevant issue as well. And thank you for the research that you're doing on this. Let me open the floor for discussion if anyone has any questions from Sun or Wang. Anyone has any question from the audience? Doesn't look like there are any questions coming from the audience. I have a question, actually. I have a number of questions, but we don't have much time to discuss, but just one simple question. Physiotherapy treatment is often used for treating low back pain, and it is to some extent effective. However, we all know that physiotherapy itself is unlikely to deal with low back pain because the central issue of low back pain is not a muscle issue. It's an issue of the vertebrae on the skeleton. It's a mechanical issue, really speaking, and it results from the dislodgement of the discs in the skeleton in the back, which touches the nerve system. So yes, I agree to a certain extent. Physiotherapy treatments are useful. However, there are different kinds of physiotherapy treatments. Have you been able to look at anything beyond the physical therapy?
Okay, about your questions, I don't have fully understand, but I think I can ask something like the low back pain or adolescent athletes. The studies is very slow, and I think the larger size need to research.
You mentioned that lumbar manipulation did not have any additional benefits. How did you find that? Is it coming from other studies, or it's coming from other studies? Is it from one study, Cell Host and Cell Host 2015? Only that study is reporting that lumbar manipulation has no additional benefit. Is that right?
don't understand your question.
I see. I'm saying this because lumbar manipulation actually has quite a lot of additional benefits and probably one of the best treatments for low back pain rather than physiotherapy. Never mind. Thank you very much for the research that you're doing and looking into low back pain, which is a very common occurrence among young people, old people, and all the people. And it's said that low back pain will be one of the most common diseases in the 21st century because we all sit at our desks for long periods of time, with no time for exercise, and make wrong moves most often than not. And that results in low back pain. Everyone gets it sitting at computers these days. Thank you very much for the presentation, and thank you very much for the research. All right, I think we have come to the end of the session, breakout session number 3. I don't know if you want to make a statement, if you want to say anything, to add.
Hello, Ranjith, thanks.
Yes. How are you? Good to see you.
Yeah, I'm taking over for a while. Thank you for a lively session this afternoon. Just a few papers for you because the other presenter actually presented yesterday, last minute. So that's why you got lesser papers. Anyway, hope to see you again in our forthcoming conference. Thank you very much again, Ranjith.
See you again.
Thank you. Bye-bye.
So a beautiful session with lots of very interesting papers on schizophrenia, dementia, and low back pain, all physical bodily diseases.
Right, we are off for tea before the next session starts. Again, thank you. By the way, Ranjith, are you still in Bahrain?
Yes, I am.
Okay, right, because you are all over the place actually. You are all over the place. You are all over the place.
Yeah. I'll be there for a little while more.
Okay, right. Thanks.
I will respond to you. I'll respond to you soon about your proposal.
Say again?
Yeah. I will write to you about your proposal very soon.
Proposal?
Yeah.
Didn't get you.
Never mind. Never mind. I'll send you an email.
Okay, we will get in touch. Okay.
Okay.
Right. Thanks. Bye-bye.
Good luck.
Right.
Good luck.
Okay. So you are off for tea, and make sure you are here by 4:40. Yeah, for the last session. Anyone for the last session?
Is closed.
Right.
Session is closed.
Session is closed.